What are the differences between filters and tints?
A tinted lens reduces the overall amount of light entering the eye by relying on the darkness or density of the colored lens. However, tinted lenses do not discriminate between functional light energy or waves that the diseased eye can still handle, and those wavelengths that are overly taxing, disturbing, or harmful light. They simply reduce all light entering the eye. Filtering lenses, on the other hand, selectively block ranges of the spectrum from passing through the lens, as well as reducing the overall amount of light energy that reaches the eye.
How is the density of a lens measured?
The amount of light passing through a lens is defined as visible light transmission, or VLT. VLT is calculated as a weighted average based on the sensitivity of the eye. The eye is more sensitive to yellows and greens than blues and reds, so it's not a simple average. VLT is expressed as a percentage, so for example, a lens with 88% VLT allows 88% of the light through the lens, while a lens with 3% VLT permits only 3% of the light to pass.
What are the key considerations when selecting tinted or filter lenses?
Tinted lenses run the risk of simply reducing the amount of light across the spectrum from entering the eye to the extent that it diminishes visual acuity. While glare may be reduced, there's a risk of causing trips and falls if the patient or client cannot see obstacles when wearing them. Essentially, dropping the VLT too low introduces other hazards and decreases visual acuity, which is the overall ability to see clearly.
How do filter lenses function differently, and to what advantage?
Filter lenses absorb overall density of light, but can also absorb light selectively across the spectrum, filtering out disturbing or harmful wavelengths and energy that the eye cannot handle, while letting only useful and beneficial light to reach the eye. For example, a filter can absorb just blue light, or blue and green light, or just red light, while allowing the other wavelengths of light that the eye can handle to pass through the lens.
Can you tell us about noir lenses and their filtering capabilities?
All noir lenses block light below 400 nanometers, filtering out UVA, UVB, and UVC rays. Some noir filters extend this to 550 nanometers, filtering out all the blue and green light. Others filter out light below 570 nanometers, which begins to filter out some of the yellow light as well. There are also filters which pass the shorter wavelengths, often beneficial for achromats, or just block the yellows. Those with brain trauma and optic nerve issues benefit. And then there are several filters which reduce the infrared light as well. Attenuating or reducing the heat energy of the sun can provide a soothing sense of relief, especially when combined with the selective blocking of some visible light.
What's the key consideration for using filter lenses for visual impairments?
It's most critical to assess both what portions of the spectrum or what light to reduce, as well as to determine what overall VLT is best. This will minimize the effect on visual acuity and contrast sensitivity, or even improve them, while simultaneously reducing or eliminating disability glare.